Welcome back here to Fox 51 today. Trinity Mother Frances celebrating 75 years, and there's another great event that's very educational. And luckily, John Moore is here to give us all the details. John, always a pleasure to see you.
Ben, good to see you.
This is something, this Trauma Symposium that's coming up on November 9th, John, is something that many markets like this don't get to see. This is what is so great about Trinity Mother Frances Hospital. You're getting big market events that you might see in Dallas or Austin, San Antonio, but you're getting it right here in East Texas. I want to know more about this. What is really the purpose of this symposium, John?
Well, it's a trauma symposium, Ben, and it's on the 9th of November. It's going to be held at Mother Frances Hospital's Weisenbaker Conference Center, and you're absolutely right. Part of what physicians and nurses and clinicians have to do to keep their accreditation in their field is to keep their education going. They, they never stop learning. And a lot of times, to learn some of the more complex new procedures or breakthroughs in their fields, they may have to travel to Chicago or to Los Angeles or to Houston, even a little bit closer. But still, with the price of fuel and hotels and everything, that can get quite expensive. And so our physicians here, headed up by Dr. Luis Fernandez, who is our chief of trauma, has not just recently, but for several years, had a trauma symposium that allows not just people that work for Trinity Mother Frances, but the other local medical facilities, and some folks come from Louisiana and Arkansas and other places, to come here for that level of learning. So it's a great event, and it's an opportunity for them to get those continuing education credits that they have to have.
Well, John, how many years has Trinity Mother Frances Hospital held this symposium?
It's been about 10 or so, and it's not just trauma symposiums that we have. We have a cardiac symposium that's also coming up. We have diabetes symposiums. Again, it's all back to the education part. If you're like teachers, physicians also have to have, as I said, continuing education credits, and this event is one of those where we're an accredited facility to give out these CMEs if that's what you need for your particular field, or nurses have something that's called a little bit different. So you'll get the credit that you need, and you'll also get a great day. And then, as I've mentioned before, the food's always really good, so that's a bonus.
Well, that's a huge bonus for a lot of the physicians. And speaking of those physicians continuing their learning, John, I know we kind of touched on this a bit, but what will they really learn again at this symposium?
Well, I think what they're going to learn is from each other. What they're going to learn is what people try new things. There's research that goes on, and so there'll be people that are brought in from out of town to speak. They always bring in the best speakers, and sometimes those speakers work right here in Tyler. And so there'll be a mix of people from out of town and from here, and what they're going to learn are new ways to treat trauma in pediatric patients and adult patients, new techniques that may save time during a critical procedure. They're going to learn what the other people have learned and are willing to share with them.
Well, and that's the great thing. It's not like a lockbox where everybody keeps their secrets away from one another. This is really a great event where people can share ideas, as you mentioned, and this is what benefits really all of us, especially the patients, John. How can people get more information about this symposium?
Well, it's our website, Ben. They can go to tmfhc.org, and there will be a link on there that they can click on and sign up. And seating is limited, and we do require pre-registration because the seating is limited. So you need to go ahead and sign up now.
Okay, very good. On November 9th, John, always a pleasure. Thanks for stopping by. We appreciate it, of course.
Thank you.